I'm Dr. Todd Battaglia. I work with Syracuse orthopedic specialists, and I specialize in sports medicine and arthroscopic surgery of the shoulder and knee joints. I'm actually from right here in the Syracuse area. I grew up in the western suburbs. I went to high school and actually grew up my whole life in Marcellus. I then went to college at Amherst College in Massachusetts, did medical school in Buffalo, and then my orthopedic training at the University of Virginia and in Boston. I was always interested in medicine, even from a very young age. I think I was considering becoming a physician from probably as young as 6 or 7 or 10 years old. I didn't know a lot about it back then, but I played a lot of sports growing up, including 2 sports in college, and as I started to get more interested in going to med school, orthopedics naturally drew me as a part of medicine where I could work with patients like myself. When I first completed my training, I actually went back to Virginia and took a job there for a couple of years, and then ended up coming back here to Syracuse for a few reasons. I was a little bit homesick. I liked where I grew up and I liked the area, but Syracuse Orthopedic Specialists now is a big group that really covers every gamut of orthopedic care. We've got experts in joint replacement, spine, and I was able to come back and help develop the sports medicine side of things. We've got a very well-run practice. We've got great doctors, great staff. It's just a very pleasant place to work. I do a lot of the basic run-of-the-mill sports medicine that includes rotator cuff surgery and ACLs and meniscus surgery. However, I also do one thing that really no one else in Syracuse offers, and that's a major interest of mine is cartilage surgery. So over the past 10 years or so, one of the newest areas of interest within sports medicine has been trying to fix cartilage injuries in young patients, either by regrowing cartilage or transplanting cartilage. So a significant portion of my practice focuses on those kind of issues right now. Taking care of the patients I do, I get the most pride of getting someone back to a high level of performance and to the level where they want to be. Well, it's something new every day. No 2 patients have the same problem, so it keeps you interested. You get to meet a lot of people and get involved in their lives to varying degrees. And again, when things go right, you can give people back a very meaningful part of their lives. Cartilage transplants and cartilage regrowth surgeries are very satisfying. I also enjoy taking on some of the tougher and more complex sports medicine issues like multi-ligament tears and knee dislocations and revision surgeries that have failed from other physicians. Currently, I'm the head team physician for the Syracuse University football team, for all of the athletic teams at Onondaga Community College, for the Syracuse Silver Knights, who are a professional soccer team here in town, and then for a number of the high schools around, including West Genesee. A lot of my time outside of the office still revolves around sports. I try to still play lacrosse whenever I get the chance. And because I'm the physician for a number of teams around here, a lot of my free time is spent on the sidelines covering games. Outside of that, I'm very interested in music, both collecting and trying to play a little bit. I play a number of things badly. A little bit of guitar, a little bit of harmonica, a little bit of piano. Mostly sort of the classic rock to folk rock spectrum, but a lot of different things. So I grew up here in Syracuse, and part of the pride of my job is being able to come back and take care of people that I've known for a long time. I have many of my teachers and former classmates that come to me for care. It's nice to contribute back to the society that you grew up in. And also it's nice to help take care of the teams here at Syracuse. I grew up bleeding orange for the football and basketball and lacrosse teams here, and to be able to now be involved with them on a medical, not necessarily an athletic level, but on the medical level is very rewarding.